Right, so you've just had a tooth pulled, or you're about to, and wondering what happens next. Now, how do you make sure everything heals properly? And most importantly, how can you prevent things like infections or dry socket? Now, here's the thing. Complications like dry socket aren't 100% preventable, but there are things we can do to try and make sure recovery is as smooth as possible. Now, tooth extractions might not be anyone's favorite thing to do, but with the right care, it doesn't have to be stressful. So in this video, I'm going to walk you through a few things. So what to expect after a tooth extraction, how to speed up healing, and also simple do's and don'ts that you can do that can make all the difference. Right, so let's start with what's happening inside your mouth after a tooth is removed. Now, the moment a tooth is extracted, your body kicks into gear into healing mode. So what it does first is it starts forming a clot on the socket. So the socket is the area where the tooth used to be, and it's got two main jobs. So think of your clot as a natural bandage. The first thing is protection. So what it does is it shields the exposed nerve and also the exposed bone, keeping them safe from things like air, liquid, food. And the second thing is it creates a healing foundation. So it creates a groundwork for new gum tissue and also for bone regeneration to happen underneath. Now, here's the thing. This clot is fragile, especially in the first 24 to 48 hours. And if that clot is dissolved too soon, or if it's dislodged, it exposes the bone underneath and the nerve underneath. So that can lead to a complication known as dry socket. And trust me, it's as uncomfortable as it sounds. So what happens is you'll probably feel, if you have dry socket, you'll feel sharp pain that can radiate to your ear or jaw, and recovery sometimes can take much longer. So the goal here is we're trying to protect the clot. So if you drink with a straw, or you smoke or spit forcefully after the extraction, you can pull that clot loose and that can dissolve too soon. But on the flip side, if you eat soft food or avoid things like hard or crunchy snacks, or even just staying hydrated, that can make a huge difference. Remember, healing doesn't stop after the clot forms. So over the next week or so, your body starts to replace that clot with new gum tissue. It also starts regenerating bone underneath. So the first 24 hours are the most crucial part for your recovery. So here's what to expect and here's how to handle it. So here's what we should expect. Mild bleeding is going to be common. So your saliva might look a little pink, and that's okay. Swelling is also common, and that usually peaks at the first 24 to 48 hours. And also soreness in the area is normal. That's just your body working to heal itself. So here's what I suggest you do. First thing is rest. So take it easy. It's not the time to go to the gym. And the second thing is use gauze pads. So bite down gently on gauze pads that you'll be provided after you have the extraction. And if it soaks through, you can swap it for a fresh one. The third thing is ice the area. So especially in the first few hours, you can place ice packs on your cheek in 15-minute intervals. So that can help reduce swelling. And the fourth thing I suggest is staying hydrated. So drink plenty of water, but make sure it's not with a straw, because if you drink with a straw, you can create negative pressure and that can dislodge the clot and can also lead to complications like dry socket. And here's what I would avoid eating. So any hard food like chips or nuts, because they can get stuck in the socket. Nothing spicy, because that can irritate the healing tissue. Sticky food, I would avoid that, especially things like gum or caramel, because they can pull the clot away. And also avoid hot drinks or alcohol, because they can slow down the healing process. Now, once the first 24 to 48 hours are behind you, the most delicate part of the healing is over, but there is still work to do. And here's how you can keep the recovery process on track. So start rinsing with salt water. So here's what I suggest you do. Mix about half a teaspoon of salt with a glass of warm water, and you can mix that and gently swish that around your mouth a few times a day, especially after meals. So I would do that from the second day up to potentially the 5th or the 6th day after having the extraction. Now, the other thing is you should avoid smoking. So you should quit smoking or abstain at least for a week from smoking, because what smoking does is it lowers your body's natural healing process, and it can also increase the chances of things like dry socket. So here's what to expect. In the first week or two, your socket, or the area where the tooth was, is going to close up significantly. But bone remodeling, so the bone underneath, that can take up to a few months. Also, mild sensitivity or tenderness is going to be normal. So what is a dry socket and how to avoid it? Now, dry socket is one of the most common complications that can happen after an extraction. And it happens when the blood clot that's protecting the socket is lost. So it ends up exposing the nerve and the bone. And it can be quite painful, because that can delay the healing, But the good news is we can try and lower the risk. So what are things that we can do to lower the risk? Now, skip using a straw for at least a week, and also abstain from smoking for at least a week. That way we can reduce the chances of dry socket. But also, as I mentioned earlier, stick to soft food and avoid eating anything hard, crunchy, sticky, and also follow your dentist's aftercare instructions carefully. And if you do end up with dry socket, don't panic, because what we can do is we can clean up the area and we can place a medicated dressing to help soothe the pain and also promote healing. So tooth extractions might sound daunting, but with the right care, recovery can be smooth and straightforward. So protect the clot, follow your aftercare instructions, and give your body the time it needs to naturally heal. And if you're curious about what happens if a cavity goes untreated or the steps involved in root canal, make sure to check out my other videos. Thank you, and I'll see you in the next one.